incision that's made against the line of stress obviously takes longer to heal, more scar formation, etc. Whereas this is placed within the lines of healing, so there's not stress across the wound, and it's in a more cosmetically acceptable position, higher up in the crease. It can be covered, so for cosmetic reasons, it definitely is an improvement.
When a patient stands in the mirror, even wearing something small like underwear, they sort of are always drawn to this big scar on the front of their thigh, and it tends to get thickened because of the fact it's against the lines of skin. So when we bring it up into the kind of the groin crease, we get an incision that almost disappears in the line of the skin. We also have the small incision we make to put the cannula in. It never has any tension on it during surgery. It's maybe a centimeter long, so that almost disappears. So in the end, the patients almost look at themselves in the mirror now without an incision, and they have a hip replacement that's working well, and that bikini incision again allowed me to just have so much easier access to the femur that it's a win-win for the patient, me, everybody.
All of the patients that I've had come back have been extremely satisfied with their result. The accessory portal essentially is gone within 4 weeks. You can barely even see it. And then the cosmesis of the bikini style incision is truly better, at least what I've seen in my patients.
The trauma associated with anterior path versus a traditional anterior incision seems to me to be less. By definition, less soft tissue trauma, they're gonna have a quicker recovery, and that's been bearing out. We're starting to now see people coming in for their opposite side, and not a single person has been unhappy or have had a negative issue where I wouldn't do them through the anterior path. So I'm getting a lot of positive feedback. And it's funny, not just like the bikini moms, even the men are appreciative of not just the cosmesis, but how well they've healed. I've had no complications with this approach.